Well, if you know anyone with fibromyalgia, then you know how painful this illness can be, but there is hope and there is help for those that are suffering from it. Dr. Alex Bigham, he is with Novocur Pain Management Clinics, and he's here to tell us more about fibromyalgia and offer some help, because for those with it, it is painful. It can keep you in bed. You can get depressed.
Yeah.
Tell me what it is and how do you get it?
Well, it's an all-over body pain, and usually they describe it as a deep body ache. Sometimes they have shooting pains. Sometimes they describe it as burning, but it's all over. I mean, they have it on the top, bottom half of their body, both sides of the body, and they need to have this all-over body pain for at least 3 months for it to be diagnosed. And incidentally, the only way to diagnose it is by the doctor knowing how to do a tender point examination. There's 18 points on the body that typically are very tender to these people, and 11 of those 18 need to be identified as being present in order to get the positive diagnosis. There's no lab test, there's no imaging test. So a lot of these people are told, you know, you're nuts. You know, I don't know what's wrong with you by their doctor because I can't do a test. There's nothing I can identify because they don't know how to do the tender point exam. So a lot of these people then have this kind of negative mental feeling towards this chronic disease syndrome that they have, because people are telling them, doctors are telling them that they're crazy.
And they don't know what it is. All they know is that they ache and they
hurt. Right, that they hurt all over,
that
they hurt all over. Usually it starts by some type of an incident, a trauma or an emotional trauma. Physical or emotional trauma is usually what sets it off, but it's generally been kind of brewing for many years. Usually it's slowly developing, and then that's the straw that breaks the camel's back, is some kind of physical or emotional trauma is what we've noticed.
So it's not like you're born with it?
No. No, but you can develop it from a young age, but women get it 10 to 1 over men.
Okay.
And usually it's going to be, you know, middle-aged women that are going to get it. So that's the typical person that gets it.
Okay, so let's talk about when people come to see you, you're able to diagnose it, or you work with special doctors that are?
Well, we have an awful lot of the rheumatologists in the Valley refer to Novocur Pain Management Clinics because oftentimes the medication management that's offered to them is ineffective, or they feel so bad as a result of the medications that they're taking they don't want to take it.
Right.
So a lot of the doctors in the Valley are relying on us. So a lot of them are referred, but if they come to us and they have not been properly diagnosed, then our doctors, which are pain management specialists, they're usually anesthesiologists that are fellowship trained in pain management, they know how to diagnose these types of conditions.
All right, now let's talk about how you can help the folks out there with fibromyalgia.
Sure. Well, as far as pain, our goal is to really reduce the pain associated with the fibromyalgia.
Because there's no cure, right?
Well, some of them do remit, and it's seemingly permanent. But for others, it's more of an ongoing process of trying to really find what the underlying cause. By the way, we have identified several different types of infections that can be the underlying cause, such as Lyme's disease or other bacterial infections that tend to hang out in the digestive tract.
Okay.
But at Novocur, our goal is to number one, get them associated with partners that can help them identify the underlying cause. But secondly, our main goal is to help reduce the pain so they can get on with life. You know, they can continue to get the kids ready for school, you know, be able to sleep at night better and that kind of thing, because these people sometimes are seriously disabled by the pain. So we have some injectable treatments that we utilize. Some are non-steroidal in nature, some are low-dose steroidal in nature. And
Does it just depend on how severe it is, or the person, how old they are, or where?
As to what we're going to do? Yeah, basically where we're going to inject is determined by where the majority of their pain symptoms are. And so we can usually rapidly diminish the amount of pain that they have. And then this really alters their mental perception, their mental outlook. And that is a big component of these people, is how is their life consumed by fear, anxiety, those types of feelings associated with the pain, or do they have a more positive outlook because there is a serious modulating effect that their mental perception has on the pain. Their mental perception can either really ramp up the pain, or if they have more of a positive outlook, like I think I'm going to get through this, then that can really diminish their perception of the pain.
Right.
And this whole syndrome is really a pain amplification syndrome. Their brain's not processing the pain signals that are received at the brain from the different parts of their body properly. It's amplifying the pain already. And then when their mental outlook is doing the same, it's a bad combination.
Well, and you guys specialize in this, so you know what you're doing, and to eliminate the pain, I mean, for so many people. You're going to be here throughout the show, so let's let you know how you can get a hold of Novocur Pain Management. They have 2 locations in the Valley, and for more information, you can visit novocur.com, or you can call them at 480-855-NOVO, N-O-V-O, which is 480-855-6686. Now, if you have a question about fibromyalgia, let us know. All you have to do is head to sonoranliving.com and click on House Calls on the right side of the page. And Dr. Bigham is going to be here throughout the show, and he's going to be answering your questions. So.